Zangline, current president of the American Acne Rosacea Society.
As president of the American Acne Rosacea Society, I have two goals. One is to mentor young dermatologists and healthcare providers so they get passionate about caring for patients with acne, rosacea, and hidradenitis suppurativa. My second goal is to work with my fellow acneologists to establish best practices for acne and rosacea, and to educate residents, advanced practice providers, and dermatologists, anybody that cares for patients with acne or rosacea, on what those best practices are. How can we achieve the best outcomes in our patients with acne and rosacea?
I'm also very proud of the declaration that we created to really incentivize people and to kind of, light the fire of people to save acne and to keep it something that's a covered entity in our clinics.
We share the mission of the FDA and the isotretinoin products manufacturing group who administers this REMS program in preventing fetal exposure to isotretinoin and promoting safe use of isotretinoin. However, what we've seen in our clinical practice and through data that's been collected by researchers is that the iPledge program is not without issues and inadvertent harms.
Our overall goal for the patient is to really treat their acne as quickly as possible. And that definition of what's quick is different per person.
People who have questions about difficult conditions or difficult to treat patients in HS, acne, or rosacea can submit their questions through kind of a question submission process to the AARS, and those are triaged to the thought leaders in those areas. And if those thought leaders feel like they need other input or they need to involve others, they will. And then that creates an answered question for a patient who might need that or a clinician.
It was with the advent of systemic retinoids, with etretinate in psoriasis and isotretinoin in acne that were clearly very, very effective, particularly isotretinoin in acne, that nobody could say, well, these molecules are not something that we need to be understanding better and developing further.
If you are struggling with rosacea, you can find a dermatologist to help you with treatment.
With the advances and so many advances in technology, there's so much information that comes out where I think a lot of people struggle, especially clinicians that are more removed from what's actually going on. How do you separate the noise from something that's really important?
The over-the-counter market is just really overwhelming. There's a lot of different products out there, and we frequently have patients come into our office wondering if they're using the right thing, if what they're using is going to be effective, if what they're using needs to be expensive or not.
I'd like to highlight Jim Del Rosso and his passion about antimicrobial stewardship and developing a consortium of thought leaders in that realm that were able to come together and create a consensus statement on antimicrobial stewardship, which I think will be transformational in our best uses of antibiotics moving forward. We know it's an important issue.
The incredible bibliography of acne and rosacea papers to draw on so that I don't have to look around for them. Whenever I need them, they're right there.
I think trying to figure out more of the pieces of the puzzle will help us try to help a lot more people.
I have rosacea and I struggled a lot with it in high school and college, and I think it held me back a ton. My personality, I would kind of get nervous to speak in front of my peers because I know my face would flare, and it's a distressing condition. So I have a personal interest in rosacea. So that was my first project that I wanted to take on.
I'm very proud of the AARS and what it has done for patients with acne, rosacea, and HS, and for what it has done for my colleagues in dermatology, providing up-to-date information with our monthly hot topics and more than a decade of research grants to better our understanding of these common disorders. I look forward to all we have yet to do.